Now, the main way to fight coronavirus, as the World Health Organization says, is to test, trace, and then isolate. So let's take a look at how we're doing on testing. And if we take a look at India's testing numbers, well, we have conducted over 2,68,45,000 tests, which is a huge number on the face of it. But if we take a look at the per million testing average, it's only 19,351 per million. That means we've tested 19,351 people per million of our population. The positivity rate, though, has come down at 8.06%. But if we compare India, just take a look at that per million testing numbers. If we compare with other countries, there you can see in the United Kingdom, they've tested over 277,000 per million, followed by Israel, Russia, US, and then India really coming in with its testing numbers per million amounting to only 19,000, around 19,000 per million. Well, to talk more about India's testing numbers and what more we need to do, we're joined by Professor Bhramar Mukherjee, Chair of Biostatistics, Professor of Epidemiology, School of Public Health, University of Michigan. Thank you so much for speaking to us again. If you can tell us your view on India's testing, WHO has recently said that India is still not testing enough.
Yeah, so we created a metric for testing shortfall, and India has done, I can tell you right now, that about 20 million tests, which is large compared to the world in terms of the absolute number of tests. But in terms of the percentage of population tested, India is only about at 1.6%. Compare this to US, which has tested about like 15 to 16% of the population. Russia has tested about 18 to 19% of the population. So we are at 1.6%. And I understand the logistics that even if we recommend, and our testing shortfall data says that in order to stay on top of the game, India needs to test 60 million more people right now. But I can say whatever I want in terms of my models and mathematics, but I also understand what is actually feasible on the ground. So we definitely should escalate testing as much as we can. But we also should really set up syndromic surveillance, which is much cheaper at a really grassroots level. Checking temperatures using community health workers, door-to-door surveys, and for people, everyone, to monitor their temperature and their oxygen regularly so that if there are changes that they can seek care. So I think we can set up alternative infrastructures in terms of symptom surveillance and monitoring and when it is not feasible in terms of resources to do 60 million more tests today.
All right. In India, there's also an issue that has emerged about the type of test that we're conducting. That's the rapid antigen test, which is a lot cheaper versus the gold standard RT-PCR tests, which are a lot more expensive. Recently, the RAT has increased, and this is, the amount of testing via RAT has increased. And this has led to questions about the accuracy, as we know that rapid antigen tests do throw up a lot of false negatives.
Yeah, this is an interesting question, and we have been actually crafting a paper on how to correct for the misclassification rates in terms of this diagnostics testing. Even the RT-PCR test, which is most commonly used, has about 15 to 30% false negatives. And that means that you are telling somebody that you are negative, but they truly have the infection. So they are going about continuing with their normal life and in turn infecting many others. So we really need to be concerned about the false negatives. So that's why if you're having symptoms, or mild symptoms even, repeated testing is necessary. So if you have a cheap test, it makes it really difficult with one single test, the outcome that you get is reliable or not. So I think persistent repeated testing could be a strategy. But I would say that the rapid antigen test is probably better than nothing, right? It is giving you some information, but I would strongly recommend repeated testing of people who are at high risk and also who are showing mild symptoms, because one test does not give us any guarantee that you do not have the infection, even for the PCR test.
All right, so that's very fascinating. You're saying to just continue testing even those who have tested negative once. That's no guarantee that you don't have the virus. Finally, Professor, anything else that you'd like to add about India and, what more can be done about how we're handling the situation here?
Yeah, as a concluding note, if I may say that, I think that, the tests are imperfect, the data are imperfect, but I think there is need for accurate model projections which can account for these imperfections and can give you the idea about the best case scenario and the worst case scenario, so that the policy making is really data driven. And this is really important for India right now, to watch each of the states at a really microscopic level, so that you can feel and track the pulse of this pandemic. We are not defenseless against this virus, and that has been showcased in various states in India and all across the world. And it takes really public and government cooperation, bringing around coordination of the sectors of public health, healthcare, social support, mental health support, financial support, all of us coming together, rallying around a common good. This is really the time for collective sacrifice, solidarity, and social responsibility.
All right, Professor Bhramar Mukherjee, thank you so much for speaking to NDTV.